Good afternoon. It is now my distinct pleasure to introduce Dr. Susan Hassmiller. She is no stranger to many in this audience. She presented during our 2017 summit on building a culture of health, and we welcome her back. Dr. Hassmiller is currently serving as a senior scholar in residence and senior advisor to the President on Nursing at the National Academy of Medicine, beginning as of January 2019 through this coming August. In this role, she has served as a key member of the leadership team for the recently released report, The Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity. She is also the senior advisor for nursing at the Robert Wood Johnson Foundation. She joined the foundation in 1997, and in this role, she shapes and leads the foundation's nursing strategies to create a higher quality of care in the United States for people, families, and communities. Drawn to the foundation's advocacy for marginalized and under-resourced populations, she is helping ensure that the foundation's commitment in nursing have a broad and lasting national impact. Dr. Hassmiller has directed the foundation's efforts in partnership with AARP on the Future of Nursing Campaign for Action. As I mentioned this morning, this initiative has served to nationally advance the recommendations of the 2010 report by the Institute of Medicine on the Future of Nursing, Leading Change, Advancing Health. Dr. Hassmiller also served as the study director for that report. Dr. Hassmiller has worked in public health settings at the local, state, and national levels, including with the Health Resources and Services Administration as Executive Director of the U.S. Public Health Service Primary Care Policy Fellowship, as well as on a variety of other national and international primary care initiatives. She has also taught community health nursing. She has served the Red Cross in many capacities, including as a member of the National Board of Governors and as the chair of the Disaster and Chapter Services Committee, and she served as national chair of the 9/11 Recovery Program. She has been intimately involved in disaster relief efforts in the United States and abroad, from tornadoes to hurricanes to the tsunami in Indonesia. Dr. Hassmiller is an elected member of the National Academy of Medicine, a fellow of the American Academy of Nursing, a member of the Joint Commission's National Nurse Advisory Council, and a member of the CMS National Nurse Steering Committee. She received her PhD in Nursing Administration and Health Policy from George Mason University, a master's degree in health education from Florida State University, and in community health nursing from the University of Nebraska Medical Center, and her bachelor's degree in nursing from Florida State University. She is the recipient of 3 honorary doctoral degrees, and she's also the recipient of numerous national awards and honors, including the Florence Nightingale Medal, the highest international honor given to a nurse by the International Committee of the Red Cross. Please join me in warmly welcoming Dr. Susan Hassmiller.
Thank you so much. Can everyone hear me? Thank you. I'm incredibly grateful for you having invited me today, and thank you so much. Thanks to each of you for your dedication and commitment to nursing, of course, and whether it's serving on the front lines, teaching the next generation of nursing leaders and researchers, conducting research, or preparing to enter the nursing field. So I'm thrilled to present to you the findings today. Some of the findings, I would say, it's a very long report, as we'll talk about, the new report from the National Academy of Medicine, The Future of Nursing, 2020-2030, Charting a Path to Achieve Health Equity. So this is my first official presentation to an actual action coalition. I've been doing other presentations, but great. I am so glad to be here with Marilyn today. The report arrives at an inflection point for the nursing profession. The past year has increased our visibility, but it's come at a great cost. Many of you know firsthand that nurses are emotionally spent from caring for COVID patients. The pandemic has also laid bare the stark inequities that have persisted across generations. The decade ahead will demand a stronger, more diversified nursing workforce that is prepared to provide care, promote health and well-being among nurses, individuals, and communities, and address systemic inequities that have fueled wide and persistent health disparities. All of you will help to usher in that future in Maryland. The report is aspirational and ambitious, and I'm incredibly proud of the committee that oversaw the creation of the report, including the chairs, Dr. David Williams and Mary Wakefield. It recognizes that nurses can play a central role in advancing health equity while acknowledging that nurses need robust education, supportive work environments, and autonomy. So the future of nursing during the next 10 years will be about caring and creating a more fair and just world for everyone. And all of you will be helping to create that world. Next slide, please. This report is the second major report. I know everyone is familiar with the first one, released by the National Academy of Medicine on the future of nursing. The first report, The Future of Nursing, Leading Change, Advancing Health, released in 2011, reconceptualized the role of nurses in transforming the healthcare system. Robert Wood Johnson and AARP then formed when this came out, as you know, the Future of Nursing Campaign for Action, a nationwide initiative to advance the report recommendations. And you have been such a key part of our efforts to strengthen education and advance practice and promote nursing leadership and increase workforce diversity. So together, everyone, you in Maryland, Wisconsin, Iowa, everyone across the country, the association, the schools of nursing, together, we have built the capacity of this workforce to expand high quality care to more Americans. Now, yes, we have a lot more capacity building to go. That is agreed. The new report that I'll discuss today builds on the gains that we've made and seeks to leverage this capacity to advance now health equity. Next slide, please. As the nursing field built its capacity, still building, we started to ask, to what end? We knew that stark health inequities existed in the United States, and we also knew that nurses have a long history of tackling the many social and economic drivers that affect health. Nurses are the largest and most trusted segment of the healthcare workforce. They work in a range of settings, and they are often the first and most frequent healthcare contact with individuals, families, and communities. So in 2019, Robert Wood Johnson Foundation asked the National Academy of Medicine to chart a path for the future to create a culture of health, reduce health inequities, and improve the health and well-being of the nation. The academies formed a committee to release a consensus report in December of 2020. While the committee was in the midst of writing the report, okay, guess what happened? The pandemic, right? The pandemic happened, followed by renewed calls for racial justice. And we realized that the only way for this report to be relevant was to delay its release to incorporate the lessons of the pandemic, the devastating toll it's taken on nurses, and the ever-growing calls for racial justice. The report is being released during a critical time in our nation's history and in nursing. When it's clear we must dismantle structural racism to eliminate injustice and inequities, nursing needs to be at the forefront of creating a more fair and just world, and we need policy reforms to unleash our potential. The report's vision is audacious: the achievement of health equity in the United States built on strengthened nursing capacity, diversity, and expertise. Next slide, please. Achieving health equity is the most salient issue of our time. I'm going to say that again. Achieving health equity is the most salient issue of our time. And I believe this is nursing's time to help lead this change. As a country, we have long failed to give everyone a fair and just opportunity for health. Brian Castrucci spoke to you earlier today about how health is greatly influenced by non-medical factors that affect communities, such as what I've listed here today. Walkable neighborhoods, good schools, fresh food, adequate green spaces. Next slide, please. Compared to white people, Black and Latino individuals are more likely to live in neighborhoods that lack healthy food options, green spaces, places to exercise, safety, and have more pollution. This is due to structural racism, defined as a system in which public policies, institutional practices, cultural representations, and other norms of work in various, often reinforcing ways to perpetuate racial group inequity. So in Baltimore, many of the neighborhoods that Black people live in were redlined in the 1930s. These deliberate policies kept Black people restricted to certain areas of a community that lacked social and economic resources. That's a prime reason for many of the health inequities in Baltimore today. The map on this slide was produced by one of the New Deal's most important agencies, the Homeowners Loan Corporation. The area in yellow was labeled definitely declining, and the red area was labeled hazardous. Baltimore is in no way unique. This has happened throughout the United States. Next slide, please. These structural inequities and racism experienced by people of color on a daily basis leads to stress, poor physical and mental health, and the advent of chronic conditions sooner among white people. These factors also put Black and brown people at higher risk for COVID. Next slide, please. The effects of the pandemic on health have been especially severe for low-income individuals and people of color. Pandemic-related household financial challenges have also disproportionately impacted those who are already struggling. Low-income individuals and people of color are more likely to live in crowded housing, rely on public transportation, and be essential workers. They're also more likely to lack health insurance and be able to access care. This makes it difficult and is often nearly impossible to follow recommended social distancing guidelines during the pandemic and puts them at higher risk of getting sick or dying from COVID. Next slide, please. The brutal killings last year of George Floyd and Breonna Taylor by police officers and Ahmaud Arbery by armed white men while he was out for a jog, and the unconscionably long list of Black and Latino victims who preceded them came after them, as well as the over 6,600 reports of hate crimes against Asian Americans and Pacific Islanders this past year underscore the need to adequately acknowledge, confront, and dismantle all systems of racism, including within nursing. Next slide, please. This report is intended to meet this moment. It contains 4 key takeaways and a series of recommendations to unleash the potential for nurses to achieve health equity. These recommendations are the consensus of the committee based on the evidence at this point in time. Robert Wood Johnson Foundation is still thoroughly reviewing and digesting the report, and we encourage leaders throughout nursing and healthcare, including those at nursing specialty organizations, hospital health systems, academic health centers, policymakers, and others to do so as well. Just to explain my position a little bit, it may sound funny that Robert Wood Johnson Foundation just got this report. So for the last 2.5 years, I think people understand I have been assigned to the National Academy of Medicine to work on this report, which put an immediate and very strong firewall between myself and the Academy and Robert Wood Johnson Foundation. So they essentially got the report when everybody else did, which means that they need time to digest this as well. The action coalitions will convene in early June to roll up our sleeves to start work on these recommendations. Next slide, please. The report calls on the systems that educate, pay, and employ nurses to permanently remove barriers to allow them to do this work, value their contributions, prepare nurses to tackle and understand health equity, and fully support nurses. The need to dismantle racism and diversify the nursing workforce is woven throughout. And I'll discuss each of these in detail. Next slide, please. Many people in our country can't access healthcare because they lack insurance, the ability to pay, and clinics or providers in their geographic area, particularly in rural and urban areas. Being unable to access care is simply unjust. Nurses can help bridge the gap in access to care through their work at federally qualified health settings, retail clinics, home health and home visiting, schools, and nurse-managed health centers, as well as via telehealth. About 70 to 80% of advanced practice RNs work in primary care, in pediatrics, adult health, gerontology, and nurse midwifery. The nurse practitioner field has grown considerably, while the number of physicians going into primary care has remained stagnant or declined. Studies have repeatedly demonstrated that nurse practitioners provide care that is equivalent to care provided by physicians. And nurse practitioners are about 10 to 30% less expensive to employ than physicians and are more likely to care for non-white, non-English speaking Medicare and Medicaid beneficiaries, including those in rural areas at a lower cost of care. And all nurses can improve the quality of care by managing and coordinating care and providing support during care transitions, such as when people are discharged from the hospital and return home. However, the ability of nurses to practice fully in these and other settings is limited by state and federal and institutional barriers and restrictive health system policies that prohibit nurses from working to the full extent of their education and training. Next slide, please. So the report calls for all organizations, including state and federal entities and employing organizations, to enable nurses. And I mean all nurses. I realize I just talked about advanced practice nurses, and that was a really focus in that first report 10, 11 years ago. But we really want to emphasize that we're talking about lifting scope of practice barriers for all nurses to enable them to practice. And that means removing regulatory, public and private payment limitations and restrictive institutional policies and practices, which, by the way, are the most significant. Those institutional barriers are the most significant for all nurses, including nurse practitioners. This recommendation continues the work of the first report. Now, while we've made considerable progress over the past decade in lifting state-level regulations, restricting nurse practitioner scope of practice, including in Maryland, 27 states still do not allow full practice authority for nurse practitioners. So we are not, I say, we are not at a tipping point on the legislative barriers, I should say. We're certainly not a tipping point on institutional barriers. So not permitting nurses to practice to the full extent of their license and education decreases the amounts and types of healthcare services that can be provided for people who need care. So until all nurses are permitted to practice to the full extent of their education and training, significant and preventable gaps will continue. Though Maryland has full practice, some of you may want to look within your organizations to see if there are barriers that prevent nurses from practicing to the full extent. And I would say certainly as we've, I was going to say, come through COVID, hopefully the worst of us is behind us. So I know many institutions have lifted barriers in these last year and a half or so. And we really want to, and there's a recommendation on that too, that those temporary recommendations be made permanent. Next slide, please. Nurses can advance health equity through their roles in care management and team-based care, preventive care, community nursing, including serving as school nurses and providing telehealth services. School nurses, for example, can bridge health and social needs and fill gaps in access to primary care. They can build relationships with students, connect them with needed resources, and address the root causes of poor health. But 25% of schools do not employ a school nurse, and 35% employ one part-time, and sometimes extremely part-time. School nurses are also unable to bill Medicaid for services that they provide. The current payment systems are not designed to pay for services that address the social and economic drivers of health and advance health equity. As a result, they often do not explicitly value nurses' contributions to care. Payment systems can enable nurses to make essential contributions to improving care and outcomes for all patients when they support team-based care, improve communication between providers and patients, and proven interventions and strategies that can reduce health inequities. And we're talking, of course, about value-based care. Nursing roles to advance health equity will only be scaled up if they are valued and paid for. Public and private payment systems should be intentionally designed to support and incentivize health care and public health organizations to enable nurses to perform these roles. New payment models, such as accountable care organizations, accountable health communities, and like I said, the value-based payment system that Katie Wunderlich spoke about earlier, can give health organizations the flexibility to address social needs and advance health equity. The report also calls for payers to implement a national nurse identifier to facilitate recognition and measurement of the value of services that nurses provide, and for nurses to be able to bill, especially now, for telehealth services so that they can reach people everywhere. Next slide, please. We need to do a much better job of educating nursing students so that they are prepared to promote health equity and improve the health and well-being for everyone. Students need to be better prepared to understand and identify the complex social and environmental factors that affect health, effectively care for an aging and more diverse population, engage in new professional roles, adapt to new technology, and collaborate with other professions and sectors. This is a real key point I want to make, and I'll bring that up again. Sectors, and adapt to a changing policy environment. Collaborating with partners outside of healthcare will be particularly important, including organizations focused on housing, transportation, social isolation, and food insecurity. I know the first report talked a lot about interprofessional collaboration. We still talk about it in this report, but the main point is for nurses to get out of their comfort zone and really start understanding, working with those other sectors that I mentioned. The strengthening nursing field will be critical, of course, as baby boomer nurses retire this decade. Okay, next slide, please. Developing a more diverse nursing workforce will be key to advancing health equity. The new report unequivocally states that the nursing field needs to address systemic racism and bias within nursing and prioritize diversity and cultural humility, defined by flexibility, a lifelong approach to learning about diversity, and a recognition of the role of individual biases and systemic power in healthcare interactions. Systemic power. For too long, the nursing profession has identified as being a caring profession and maintained an identity of color blindness. I know myself, I was always so proud coming out of nursing school and in my practice throughout the years. I've always been so proud of being colorblind. I didn't see color, not realizing that that was really a detriment and a barrier to really dismantling the racist attitudes that we all have. Color blindness was admirable, of course, in its intent, but it was wrong. It unfortunately made us blind to the structural racism that is long existing in the profession. So we need to acknowledge and confront structural racism in nursing so that we can then address the systemic barriers that keep the nursing profession overwhelmingly white and female. Despite decades of emphasizing diversity, and I know the Maryland Action Coalition has worked on this as well, the nursing field remains approximately 80% white, even though white people make up 60% of the US population. The gap widens further for nurses in leadership positions, including in academia, with about 90% of nursing leaders coming from white backgrounds. Nursing students and faculty must reflect the diversity of the population and break down barriers of structural racism, present in today's nursing education, including in the curricula, institutional policies and structures, and the formal and informal distribution of resources and power. All nurses need to communicate and connect with people of different backgrounds and be self-reflective how their own beliefs and their own biases may affect the care that they provide. Diversifying and strengthening the student body and eventually the nursing workforce requires cultivating an inclusive environment, recruiting and admitting a diverse group of students, and providing students with support and addressing barriers to their success throughout their entire academic career and on into their practice. Next slide, please. We also need to increase the number of nurses with PhDs who focus on the connection between the social and economic drivers of health, health equity, and the overall well-being to build the evidence base in this area. We need to also ensure that PhD nursing graduates can design and implement research and that addresses issues of social justice and equity in education and health and informs policy. Nurses with PhDs are also needed to teach the next generation of students. Increasing the number of nurses with PhDs will require financial resources, including scholarship and loan repayment opportunities, adequate numbers of expert faculty available to mentor these students, and curriculum revisions that focus on equity. All PhD graduates should have competencies in the use of data on the social and economic drivers of health as context for planning, implementing, and evaluating care and for improving population health through large-scale data application. They should also be able to design and implement research that addresses equity in education and health and informs policy. Maryland is an exemplar in providing graduate nurse faculty fellowships to increase the number of nurse faculty. In 2021, 45% of the nurse faculty selected for your program came from underrepresented groups in nursing. We need programs like this disseminated throughout our entire country. And I just want to say, because I do get questions, why not talk about the DNPs? I think everyone knows that we had a big recommendation in the last report to double the number of doctorates. I think we've just about tripled the number of doctorates in our country, and pretty much solely on the basis of bringing DNPs into our profession, which is great. I am thrilled that we have so many well-prepared nurses with DNPs, but we need more balance now with PhDs, and I think everyone can understand that. Next slide, please. Right now, content about the social and economic drivers of health, health equities, and health inequities and population health are not well integrated into the undergraduate and graduate education. Nursing education programs should ensure that nurses are prepped and prepared to address the social and economic drivers of health and achieve health equity. Schools of nursing need to integrate these concepts and competencies through the entire coursework. Schools should also expand community learning opportunities, subsistence education in the community, such as schools, workplaces, home health care, public health clinics, and telehealth settings. Allow nursing students to learn about the broad range of care environments and to work collaboratively with other health and non-health professionals and other sectors. Students need to actively engage in experiences that will expand and diversify their understanding of nursing practice, prepare them to care for diverse populations with empathy, and allow them to build the necessary skills and competencies to advance health equity. Next slide, please. Now, fully support nurses. Nurses need to feel healthy and well supported in their workplaces to effectively care for people and to advance health equity. As I like to say, nurses cannot give what they don't have. Nurses can't give what they don't have. But the pandemic has taken an unprecedented toll on the nursing workforce. Before the pandemic, many frontline nurses worked in understaffed settings and still do, of course. They were overworked and burned out. Many worried about bullying and violence in the workplace. Many also cared for children or elderly relatives outside of work. Their stresses have been exacerbated by COVID. Of the more than 12,000 nurses participating in a December 2020 survey conducted by the American Nurses Foundation, Pulse of the Nation's Nurses, most share that they currently experiencing a higher likelihood of depression, anxiety, and distress from when they were surveyed back in spring of 2020. During the spring administration of the survey, 50% of nurses indicated they were overwhelmed. The second time they were surveyed, 72% said they felt exhausted and overwhelmed. Next slide, please. For over a year, nurses have risked their lives and the lives of their loved ones to care for others. They've cared for multiple critically ill patients at once and served as additional support when their families couldn't be physically present. They've used their own iPads to set up calls between patients and family members to say goodbye. And then they've stayed with their patients so they don't have to die alone. Other nurses have quickly moved floors and have had to rapidly adapt to caring for a large number of COVID-19 patients, often without adequate training. I don't know who had training for this pandemic, honestly. Nurses are working long shifts, sometimes without the personal protective equipment needed to stay safe. I certainly hope everyone has the personal protective equipment now. Over 550 nurses have lost their lives to COVID, a disproportionate of whom have been nurses of color. Some nurses who have spoken up to demand adequate protective equipment have lost their jobs, which is an outrage. They've also faced stigma from the general public. What the workforce has been through is unjust and unsustainable. One of the main imperatives from an ethical advocacy and policy standpoint in the next decade will be to improve nurse well-being so that nurses will be able to provide high quality, safe care and to continue to care for all patients in all communities. That includes tackling the systems, structures, and policies that create workplace hazards and stresses that lead to this burnout, fatigue, and poor physical and mental health among the nursing workforce. Next slide, please. To fully support nurses, we also need to address and eliminate racism in our workplaces. Nurses of color repeatedly report experiencing discrimination and bias within their work settings. All nurses need to create a culture of equity in their workplaces. We need a culture of change. We all need to have each other's back and be in this together. Our workplaces should reflect the patient population they serve, and everyone needs to practice cultural humility and be aware of their own biases. Implicit and explicit bias training and cultural practices accepted and championed by leaders within the institutions where nurses work will be critical. Our workplaces need to recruit, retain, mentor, and promote nurses from underrepresented backgrounds, and we need to advance nurses of color to leadership positions where they are sorely underrepresented. Next slide, please. The report includes a number of recommendations to fully support nurses. The main one is that by 2021, nursing, this is 2021, isn't it? Nursing education programs, employers and nursing leaders, licensing boards, and nursing organizations should initiate. I didn't say that we should be complete, but by this year, everyone should initiate the observation and certainly some implementation of structure, systems, and evidence-based interventions to promote nurses' health and well-being, especially as they take on new roles to advance health equity. Nursing education programs, for example, can integrate content on nurses' health and well-being into their programs to raise their students' awareness of their importance and provide them with training and support as they transition to practice. Next slide, please. I also want to note that the report calls on all nursing organizations to work together to create a shared agenda. They should identify priorities for education, practice, and policy, and develop mechanisms for leveraging existing nursing expertise and resources. Creating a shared agenda across these groups, working together. Normally they work in silos, right? The Tri-Council over here, the Council of Public Health Nursing Organizations over there, Federal Nursing Service Council, which is a council comprised of nurses in the Army, Navy, Army, Navy, Air Force, veterans, Red Cross, U.S. Public Health Service, and Uniformed Services University. And then, of course, the National Coalition of Ethnic and Minority Nursing Associations. Will be much more successful if all of these nursing organizations draw upon each other, leverage each other, use each other's expertise. That's what we're calling for. Next slide, please. The report offers many additional ways for individual nurses to get involved in advancing nurse equity. For nursing educators, you can see some ideas on this slide, including developing competencies to advance health equity. And I think that the new essentials report, aligning that report with what's going on in your school with this report will be very helpful. Initiating dialogues about racism and inequities in your classroom, really, really important to have those hard and crucial conversations. And then mentoring, sponsoring students from underrepresented backgrounds in nursing. Next slide, please. There are many ways that individual nurses and practice can get involved in advancing health equity, including modeling behaviors that promote a culture of diversity, equity, and inclusion. Getting involved in advocacy, especially getting students involved in their schools of nursing. Being aware of your own implicit biases, first and foremost, and taking trainings to address them. Investing in your own health and identifying and disseminating best practices to promote equitable care. Next slide, please. Here are some examples of how nurse leaders can get involved in advocating for organizational policies and structures that support nurses and promote equity. Leaders can shape the day-to-day work life of nurses, set the culture and tone of the workplace, develop and enforce policies, and serve as role models of well-being. Next slide, please. And then finally, nursing research is vital to advancing health equity. The report notes that strengthening and diversifying the nursing workforce of the future and fostering nurse well-being to enable nurses to advance health equity will require a robust and rigorous evidence base. The report calls on various government agencies and foundations to bring together representatives from nursing, public health, and healthcare to develop and support a research agenda. This includes proposing, evaluating, and scaling evidence-based practice models to advance equity, identifying multi-sector team approaches, reviewing and adapting evidence-based approaches to diversifying nursing schools and faculty, determining evidence-based education strategies for preparing students to eliminate structural racism and implicit biases, and improving the use of IT infrastructure to identify and integrate health and social data. The report includes a table of research topics that needs to be addressed, and please check it out in the back of the report and determine how you might get involved in advancing a research agenda to achieve health equity. So here it is. Next slide, answering the call. The next decade offers tremendous challenges and opportunities for the nursing profession. I do not want to leave nursing out of this equation at all. More than ever, we need to tap the full potential of all nurses, not just those in leadership, not just those in academia, not just APRNs, but all nurses in every setting, so that we can achieve what our country needs for everyone, no matter who they are, where they live, to be able to experience good health and well-being. New and established leaders at all levels and all settings are needed to lead changes that result in meeting social needs, addressing the social and economic drivers of health, and ultimately achieving health equity. My hope is that all of you will be able to answer the call to create a world where everyone can experience the best possible health and well-being. I thank you. I know that was a lot, and I really sort of ran through that very fast. is a very long report. Here's what I'll say, outside of my formal notes. Like the last report, some people say, well, I didn't see this recommendation or that recommendation. And I want to emphasize again that the recommendations in this report are only those that could be made based on evidence. Committee members may have wanted to make other recommendations, wanted to go above and beyond, but couldn't because the evidence kept them to where they finally landed. The other thing I would say is, make this your own report. There's a lot in here. There's a lot of recommendations, 9 big recommendation areas, and 54 recommendations all told. Work on what most aligns with you, what you're most interested in. And if you don't see something in this report, unbelievably, because I think we put in a lot, make it your own and, add in what you want. This is the time for advocacy now, not this report, but now we're going to take it forward. Thanks, everyone.
So thank you so much, Dr. Hassmiller. We're going to take about 15 minutes for questions and answers, and I will be using the chat box. People are writing in, and I'll be sharing their questions with you. So the first person is talking about school health nursing, and you talked about it as well in terms of the importance of school health nurses. Do you have suggestions on how we can get lawmakers and leadership to fund public health so that there is actually one school nurse per school or per building?
Well, thanks, Jane. That's where the advocacy comes in. Now, there was a large piece of legislation that called for, what was it, $500 million for public health and school nurses. So that is, I don't know where that is at. I need to figure that out, but that's viable. And if you look this up, put it on your website and have people call their legislators about this. It's really important. If you're involved in, everyone is involved in a community, a PTA, a county school board. This is the value of nurses, I think, but you have to have examples because remember, everybody is budget crunched. Everybody is budget crunched. This is why we don't have a school nurse in every school. Lack of information and lack of budget. But I think this pandemic has really been vital for the importance of school nurses. It really has struck me as interesting. I have other words for it, that all these back to school policies that were made really devoid of health information or a health voice, I should say. They tried to look at CDC guidelines, right? Everybody's looking at the CDC guidelines. But if they only had a nurse or a school nurse helping, I'm just giving you an example with some of these policies. Let me just say one more thing. I always say we have to work as nurses both sides of the fence, because I always tell people now, you've got to work with these other sectors and get yourself out there. But these other sectors need to understand the value of a health voice and a nursing voice. So we have to work with nurses to get them comfortable in working with other sectors. They need to practice. They need to sort of dip their toe in the water in the community. Public health nurses and school nurses do this all the time. That's why I really strongly advocate drawing upon the expertise of school and public health nurses. And then we have to get the messages to those other sectors about the value of nursing.
So this next question talks about the APRNs and the fact that they're reimbursed at 80% of MDs. And the question was posed whether the IOM or the RWJ Foundation is taking that up. And I know there's probably some restrictions, at least for the foundation. So do you see any movement in terms of the APRN reimbursement rate?
Well, the National Academy of Medicine and Robert Wood Johnson Foundation, as you alluded to, Jane. We're not in any kind of positions to take a stance legislatively, but our partner, AARP, they have a very large lobbying arm, which is why we have partnered with AARP for all of these years now. They've been working in, a multitude of states, and may have also worked in your states, the red shirts, they call them, the AARP red shirts. So they are really the entity who can help with this. And then it honestly, it takes people within the state, because these are institutional policies and legislative policies, and the powers that be want to hear from people in their own state and their own institutions. So we have to have those strong research. We certainly know that research is not the answer, the sole answer, because we have research until the cows come home, and we're still not at a tipping point. So it takes relationships, research, stories, and connections, and constantly being connected and on this issue to make it happen.
So I think without a doubt, clearly RWJF and the National Academies have given us the information to be able to do our work in terms of our legislators as voters and as institutions. So for folks who don't know, it's not that the Academy or the academies or the foundation are not invested in it, it's because of their tax status that they can't lobby. So I think sometimes that's confusing to people. So just as a point of clarification, in terms of, you talked a little bit about the changing policy environment, and can you talk about how we should be addressing that within our nursing education programs as you see sort of the evolution of policy?
Yeah, if I'm getting, if I don't get this exactly right, Jane, just let me know. So with a changing policy environment, how do we bring this back into schools of nursing? Is this what you're saying?
Mm-hmm.
Yeah, I mean, you're a dean, a very successful dean with a fabulous program, and there's curricular are busy places. There's a lot packed in for students these days, and I've heard so many faculty, what more can we put in this curricula? But I think, as you heard Brian Kostrucci, I didn't hear him this morning, but I've heard him before and I know him well. And he would say that it's really policies that make the biggest difference. Nurses are really good at taking care of social needs. If your patient or client needs food, referring them to a food pantry or something like that, that's addressing a social need. But really going upstream and working on policies for the masses, legislatively, or big P or little p, really makes the biggest difference. So if in nursing school, you can at least really drive that home, how important being involved in the policy making effort is, and really giving students, even at the undergraduate level, a chance to get their feet wet with policy in maybe leadership courses, really identifying policies that are working or hindrances, and coming up with ways creatively as to how they would approach it. So I hope I answered you a little bit.
Thank you. So as you talked about PPE and the availability of it, we have a participant who is a school nurse, and unfortunately, she's not been able to secure PPE within the school system due to the price gouging. And so I think in our schools, we may still not have what's necessary. So I think that's just a heads up for all of us as we work within our systems and potentially reach out and see if there are shortages in those arenas. We should be thinking through strategies to be of assistance. So we'll take that challenge on to think about.
Yeah, I hated to hear that. I just hate to hear that.
Yeah.
And I'm so sorry.
So, so much funding, including the foundation, is aimed toward academia, but when nurses get into the workplace, the funding no longer supports sustainable programs designed to help them beyond their graduation. Will the solutions in the future include supporting health systems so they can help support their nurses?
Well, first of all, I want to go back. The premise was made that we primarily support those in academic settings. I'm not sure that's the case, especially these days, if you were referring to Robert Wood Johnson Foundation. I'm not sure about that. But I think in order to support nurses fully at the institutional level, I think that nursing leaders nursing leaders really need to look at their own institutions. If we're talking about financial fixes, there are some financial fixes, but there are other things or other policies that nursing leaders can do within institutional workplace settings that really don't take a lot of money per se. It just takes strategy. And, let me just give a real practical thing that just came to my mind. And that is that nurses who work in institutional settings and leaders really need to be involved in crucial conversations. I'm not sure what kind of money that takes, but it's a state of awareness. It's right, being kind and respectful to one another. It's understanding that we're all on this learning curve together. Many people have understood this for decades. Racial discrimination and structural racism. Some of us are just coming to it. So having that awareness, understanding that it's real and really noting the realism of it, and giving time and space and understanding and patience to have those conversations, and the allowances to not call other nurses out, but with kindness and respect, saying, well, maybe there could have been another way of handling that. And so I just offer that. It seemed like a financial question. And I just want to say that there are some financial fixes, but there are a lot of fixes that are just not financial. It comes from ourselves.
So there's a question about, is the report available? And actually the report in a draft form is available, correct, Sue? In terms of if you Google it?
That's right. If you just go to the National, so go to the National Academy of Medicine website, click in the Future of Nursing 2020-2030 report, and everybody can download this for free. It is over 500 pages. So if you have enough paper, you can print this off for free. What I would recommend is certainly printing, and you can do this in sections. You're allowed to print it in sections. So the summary, the vision, and certainly the recommendations and the recommendations at the end, and some of the chapters that you are interested in. I think, sometimes people ask me, what's the most important recommendation or the most important chapter? Obviously, they all work together to help us get to where we need to get to. And also, if you go to the National Academy of Medicine website, if you sign up for the listserv, you can get all of the educational materials that we're now working on. So I'm really busy now. We have an infographic. We have 1 to 2 page summaries. We have the press release. We're working now on podcasts and webinars that will dig deep into some of these recommendations. So if you're on the listserv, you can get alerts and you'll get all this for free. Now, what you can't get for free is in a couple of months, if you're used to that hardbound book, that blue book of the first report, We're doing that for this report as well. That will cost money. If you want it hardbound and a nice bookshelf copy, that will cost money.
So this sort of builds on one of the earlier questions, and it's from a D&P student who would really like to get involved in advocacy work. And she's seen some of her faculty who advocate on Capitol Hill. So how do you even start to get there? And I would say I'd be reaching out to those faculty and say, please, please, can I come along? Because it's always the first time that's the worst time, because you're nervous and you don't quite know what's going to unfold. But go along with somebody with experience. And I know the folks of us who do this, we would welcome your involvement, whether it's through a specialty organization or through the American Association of Colleges of Nursing. So Sue, I don't know if you have other thoughts to add.
You hit it. That's exactly how I would phrase it. All of the associations, if you're involved in an association, would love to have you be involved in that. And I'll give you a real big clue here. Your local legislators and even your state Congress people, you know, they don't know about health. They don't know about nursing. Especially the local legislators, they really welcome someone who can come along to say, look, you know, I volunteer. I want to be part of your strategy development for health in the county or the state. And just begin to sort of make those connections. Sometimes they'll ignore you. Sometimes you'll get in just at the right moment when they're working on a piece of health legislation and they don't have a health voice, and they'll say, oh, come on over. So that's usually how those things work.
So it looks like we have time for one more question, and this is a tough one, and you've talked about it in terms of our own self-awareness, but this is from a novice faculty who would like to tackle systemic racism with a diverse group of nursing students in class or in clinical settings. And what advice would you give her or him?
First of all, bravo. Just that's really the first step, is that awareness step and the willingness to jump in and just learn and have patience with one another. You know, just look at the curriculum. This may be what you're asking. Look at the curriculum, and with a number of eyes on it, especially people of color, they'll be able to point out pretty immediately where they would have wanted more information or more representation from people who look like them. And once you get that input, that feedback session, then you can begin to determine, you know, how that curricula, how your lectures and your presentations might be better formulated, who you bring in as guest speakers, what videos and podcasts you assign. So that's a great start. I give you lots of kudos for wanting to start that process. That's where we all need to start.
So Sue, thank you so much. The work that you've done over the past decade has been just phenomenal and has had a massive impact in terms of what we've been able to accomplish here in Maryland and beyond. And we thank you for your leadership. For those of you out there listening, if you are not a member of the Maryland Action Coalition, I'm going to put in the chat box the form that you can complete so that you can be on our distribution list. We'll be going through a process of taking the new report and making it real for Maryland in the coming months. And so everyone, please join me in thanking Dr. Hassmiller.
Thank you. I am so proud, Dean Kershley. I'm so proud of Maryland. You have made so many accomplishments in that state, and you're used as a role model in the country among other action coalitions. I think you know that. So I so appreciate your leadership and your team and everything you've done in Maryland. Thank you to you as well.
Yeah, and I think we couldn't do what we've done without the amazing investment of the Health Services Cost Review Commission through the Nurse Support Program dollars. Yeah, we are the only ones standing with that kind of funding. So to everyone, you now have a break, and then you will go into the poster sessions, and please do vote for your favorite poster. And then Dr. Pat Travis will see you at 4 o'clock to announce the winner, as well as to bring some closing remarks. So again, thank you, Dr. Hassmiller. Everyone take a break, stretch, and we'll see you along the way.